New Disabled South presents.
Before my life expires, that I can see that change so that other people in my position have that hope to hold on to for a brighter future, because every human being deserves that.
In Arkansas, Jacqueline advises federal officials on disability policy and serves on the state's Medicaid board. Yet, despite holding a master's degree, she's also trapped in poverty by the very programs that keep her alive.
I don't make enough money to pay someone out of pocket $700 a day, which is roughly what it costs for a private pay 24-hour care services.
Born with cerebral palsy that affects all four limbs, Jacqueline has navigated Medicaid for 37 years. When her father died, she became what Medicare calls an adult disabled child, suddenly eligible for both programs. Today, she'll show us how dual coverage saved her life through stage 4 cancer and what it costs to require 24-hour care in America.
It really gives me the chance to continue to be the voice for our community.
This is a story about expertise born from necessity and the paradox of understanding these systems better than the policymakers who create them, while remaining trapped by rules written decades ago. I'm Stacey Abrams, and this is Dual, the true cost of care.
Dual, the true cost of care. The expert patient.
Jacqueline's walls tell two stories: her master's in rehabilitation counseling from the University of Central Arkansas, a bachelor's in psychology from Fayetteville, and certificates from disability advocacy boards. But her real education has come from living inside the system.
I never intend to put my disabilities in the forefront of my brain, because I grew up in an environment where I was taught that that's not the most important aspect of my life. So I kind of tend to forget to even mention it sometimes. But I have cerebral palsy and spastic quadriplegic, which basically means that all four limbs are affected. I'm obviously, by the grace of my higher power, able to speak and think for myself. It damaged the part of my brain that tells you how to walk and tells you how to connect movements so that you can move quickly. It also damaged the part of the brain that tells you when to use the restroom on time. God didn't give me a big mouth for no reason.
Diagnosed at a year old in 1987, Jacqueline's cerebral palsy resulted from oxygen deprivation before, during, or after birth.
After being on the waiting list, literally from the time I was 8 to the time I was about 21, 22 years old, we had to go through this whole justification process, and I had to prove my case and why I needed services. And after being denied about 3 to 5 different times. Even with a lawyer on my side, I ended up getting granted 24-hour services by the time I was 26 years old.
Medicaid funded aids for her daily care, giving her independence and opportunities most people didn't expect.
I wouldn't be able to thrive in the community, and I would be forced into an institutional setting, and for me, that's just devastating.
And she did thrive, earning 2 degrees, serving on state boards, even singing at Carnegie Hall with the National Children's Choir.
Medicaid waiver is what afforded me the opportunity to go to college, to learn, to be independent, to grow into my own person. 5
years ago, her world shifted.
My father died in July of 2020. Unfortunately, he passed away when I became eligible for Medicare through the state's eyes because I was deemed a disabled adult child of a deceased disabled parent.
Instead of zero SSI income, she began receiving SSDI based on her father's work record. That made her dual eligible, with Medicare billing first and Medicaid covering the rest. But it came with a catch.
I had to start paying for things that were medically necessary. I had to start continue to pay for housing. I had to pay for food and shelter. I had to pay for adaptive equipment necessary for daily living, stuff that insurance won't cover. I still try to cover if I can.
That criteria? $2,000 total. A limit unchanged since 1989, when that amount could actually cover an emergency.
I go month by month.
Testing the system.
Jacqueline doesn't just endure these rules, she challenges them. She serves on boards, speaks with federal officials, and pushes for reform.
Medicare has no income boundaries as far as it doesn't count against you. Like if you make a certain amount, but with Medicaid, you really have to stay under that $2,000 resource rule.
Think about that number, $2,000, frozen in 1989, even as inflation has more than doubled the cost of living.
But once you're on it, you basically have it unless something fluctuates with income to where you don't qualify anymore.
The injustice is clear. Then came cancer.
Basically, they thought it was gastrointestinal issues related to my disability because I wasn't really feeling discomfort. And I'm an active person, and I was doing a lot of things, volunteering for the community at the time. So they tested me for all these things, and then something told me just to go to the hospital and get the CAT scan done. So I did, and that's when they found the mass. And because I had not had any emergency procedures up to that point, that year, Medicaid was able to cover the surgery, which was the initial surgery that ultimately saved my life.
And yet, because Medicare covered the primary bills and Medicaid picked up the 20% gap, she survived. Still, Medicare has a critical gap. It only covers skilled care for a short time after a hospital stay. That's where a special federal program comes in. The TFRA waiver, originally designed so children with significant disabilities could qualify for Medicaid regardless of parental income, now allows adults like Jacqueline in Arkansas to access the 24-hour care Medicare would never cover.
The cost of independence.
Her father is gone, her stepdad has health issues, and her mother can't provide care the way she once did. The cost of independence reveals itself in the price of equipment.
That one piece of equipment alone without insurance costs about $3,600, and that doesn't include service and repairs for it. And in order for insurance to be able to cover service and repairs, you had to have insurance purchase it, because if insurance didn't purchase the equipment, then they can't cover service and repair fees either.
Even with the best private insurance, she says, it would never cover what it truly costs to live with a disability. Her dream job? A 911 operator, a way to give back like nurses give to her every day.
I would be in the emergency room setting, and I would be a MEMS operator. I would be taking care of people behind the phone lines, taking 911 calls, because that's something I know I could do.
But the system won't allow it. Instead, she pours her energy into education and advocacy.
I would want them to know what it felt like for a day to be in our shoes, to have to completely and utterly rely on somebody for your every physical aspect of life, for your every physical need, from going to the bathroom to, eating, to dressing, to showering. I would want them to know what that felt like, at least for a day, because I think if they experienced it, they would start to think about other ways to help people maintain their independence.
From her seat on state boards, Jacqueline works with Arkansas DHS to improve policy, but she knows the limits.
I just don't think shutting down programs is the answer. Not only is it going to cut funding for what is already paid for that sustains human life, it also cuts people's jobs. Like, if people can't sustain healthcare positions or caregiving positions, or if raises are not considered for these people, then essential workers fade, because eventually they're gonna have to find another position that's sustainable to be able to meet their needs and to meet their bills.
A uniquely American paradox.
Jacqueline embodies a uniquely American paradox. A master's degree holder who can't save more than $2,000 by law, not intention. An advisor to federal officials, yet she still must count pennies to qualify for care. A woman who understands Medicare and Medicaid better than most bureaucrats, yet remains trapped by outdated rules.
I can only hope that by the grace of my higher power before my life expires, that I can see that change so that other people in my position have that hope to hold on to for a brighter future, because every human being deserves that. I can say, with all the realities of everything that I've presented about services with you today, that I'm grateful for people that do show up. I'm grateful for people that do say yes. I'm grateful for people that do make the sacrifice despite the low amount of pay. I'm grateful for the people in my life that still halfway do what they can for free, even when it's not that much. My experiences are truly what makes my world go round, and I've just come to realize that I might not always be rich in the financial sense, but I'm definitely rich in love, and that's something to truly have gratitude for.
Dual eligibility saved Jacqueline's life. It funds the aides who get her out of bed, the equipment that lets her move, the medications that keep her alive. But it also locks her into poverty, discourages work, and forces impossible choices between security and survival. This is what dual eligibility looks like. A life sustained, but never truly free.
To learn more about Dual, the true cost of care, tell your dual eligibility story, or to get involved, visit dualcostofcare.com.